having us here. Let me first say that there is nobody in the Department of Health and Human Services that likes what's happening right now in terms of what we are having to implement. I think there's a couple of pieces that we need to back up and kind of let you know how we got here. And that was literally several years ago. There was an issue about comparability with the federal government. And what comparability means is that if you offer a Medicaid service under our regular state plan, then services have to look the same, if you will, as in the community as it does in a facility. And in this particular case, it was started all out about personal care services that were being provided in adult care homes. I think what some people didn't realize is not only was it adult care homes, it was also group homes because personal care services were being billed in group homes as well as in adult care homes. So we started working with CMS, the federal government, on fixing that problem, and it's been over quite a few years. We identified several options, and the first option that we agreed to, and we actually had a corrective action plan with CMS, with the feds, that we would produce what's called a 1915I. That's a different kind of authority to get the money paid for. What that did was we looked at the eligibility criteria because you can't have a service based on place of residence. And that's what was happening. The people who lived in their own home who were getting PCS, whether you had a disability or not, because people who are elderly are also getting this service. It didn't allow you to have it one way for people in adult care homes, or one way for people in group homes, and one way for people that lived in their home, whether it was my mom or my sister or whomever. So we had to fix the comparability. There was a lot of conversation about how to fix that comparability. It looked at different eligibility criteria. It used to be in the community, it was 2 activities of daily living, whereas an adult care home was 1 activity of daily living. And that was true for group homes as well. So as long as a person needed hands-on assistance in a group home or adult care home with bathing or eating or toileting or mobility, they could get paid for that service. Well, we had to fix that. So as this last legislative session, we started having those discussions about what the impact of doing that 1 ADL across all of North Carolina's population, because you have to have comparability. You couldn't have 1 for the group home and 3 or 2, because it had already been changed for in-home for living in the community. So it had to be equal. There was significant concern about the cost of doing that, about how to, and you'll hear a good word that we love in the Medicaid world, and that's called woodworking. And woodworking means that people who could would show up and cost more, would actually, even though they've never gotten services before, could start to appear. So we had to predict or project woodworking if we went with 1 ADL, if we went with 2 ADLs, or we went with 3 ADLs. The General Assembly passed the legislation on 3 ADLs, which means you had to have hands-on assistance with 3 ADLs, no longer 1, no longer 2, but 3. It did say, however, that if it's 2, and you need extensive hands-on, there was a little more room for 2 if it had to have additional criteria. So we were providing and have provided and continue to provide updates on that eligibility criteria. We have said across the board, because not all group homes bill PCS. There are many group homes that don't bill personal care services to Medicaid at all. Funding is totally either state appropriations or through what Jim's going to talk about, through state dollars. Not all group homes build PCS. So we project for 5,600 group homes that number is going to be anywhere from 75 to 100% of people that won't qualify at that 3 ADL level. Now, we project, right now we were looking, for example, in some of our data, there were 990 some people who were billing PCS. Now, there's a lot more people in North Carolina that live in group homes other than those 900. But of the ones that we know about, that was our early projections back in December of 2011. So that's over a year old. One of the things that is happening now is that everybody in adult care homes and group homes have to be evaluated through an independent assessor. And that independent assessor has to come on site and conduct the review so that it's no longer on whether the group home manager thinks she meets the qualifications or not. It is totally somebody who's independent who has to come on site and conduct an actual review. And the process is all the same whether you live in-home, by yourself, in your own apartment, in your own house, whether you're old, like me, or whether you have a disability, or whether you have any other problem that would get you from, whether you had your hip broke, whether you had whatever, it's the same criteria. So that's what's happening now. We have to have those completed by November. At that point in time, we will begin in the October-November time period to start letting people know whether they meet the qualifications or not. If they meet the qualifications as of January 1, which is the effective date of our corrective action plan with the federal government, you would continue to get this new kind of PCS, which basically is still the same PCS, it just has a different eligibility criteria. If you don't meet that criteria, that independent assessor has decided based on the criteria that you don't meet, then recipients, people will get a notice of appeal or a notice of decision. At that point, they have the right to appeal that decision. So that's how the process will work.